Like I said, I really want to make sure that you guys are getting the right directions, and then you are getting the right information. Now, if we are able to do that, then the rest is on you. You understand what I'm saying? So Rachel reached out to me and I said, well, why not? I definitely want to see them, talk to them and find out. Because you have an exam on Wednesday. Today is Monday. If you have not looked at this information, well, your likelihood of passing is very small. I want to make it very clear to you. It doesn't matter who teaches you this. If you haven't looked at it until now and you're going to pick it up, let's say tomorrow or today when you go home, oh, I'm going to start studying, and two of them here, I mean, you've shot yourself in the foot before you even start. This is my recommendation to you. Every time you have a lecture, right? The same day lecture is over, you've got to pick it up. That same day when you leave here, you must read it again. Like go back, go into the, what is this talking about? What was she saying? She said this. What does that mean? You have to spend at least 3 hours on that when you leave class. Are you listening? That's what you have to do. You cannot pick, especially pharmacology. You cannot pick the PowerPoint 2-3 days before test. You won't pass. Okay? Because it's new to you. The information is very new and it's very difficult to understand. This is so easy though. This PowerPoint here is very easy. So let's flip through it and see what is in this PowerPoint. That makes me say, it's so easy. And how is it that if you've looked at it, like you said, I've looked at it and I feel like I'm going to fail. You shouldn't feel that way. So let's go. So this PowerPoint certainly begins receptor sites in the body, agonist medication. What's your name? Javon. What is agonist? What does that mean?
It blocks. No, it says they block. Oh, that's
okay. So
like naloxone.
Okay.
So here you are. You have two words that you're putting it together. Agonist and antagonist is in Form 100. I've taught both of these classes before, so I know where you're supposed to get that. So this is not a time to try to figure out what does agonist mean. You should already know that, but that's okay. It's just one word, and I want us to. And trust me, look, I'll be asking questions if you get it wrong. It's good you get it wrong here, so that we clarify it, right? Than to think you know and you got it wrong on the test, or you don't know when you know. So don't worry. This is a learning process. We all go there. Don't feel bad. Feel free. Express yourself. Let's figure a way to make sure that this works for you. Okay? So, all right. So agonist. Agonist and antagonist. Agonist means that it's able to definitely, produce its desired effect, which means it works well, it fits into whatever we are describing. Antagonist means it works against it. It rather reverses the effect of the whatever medicine that we are giving it against. Well, that's what antagonists do. So very, very little or small. Medications, agonists, that fit into a receptor. Just like it is described as like a lock and key. Remember, before a medicine can work, the medicine should be able to bind to the receptors, right? The receptors will have to take it to the targeted site so that the medicine can have effect. For instance, you take a medicine you feel like you're nauseated, right? Well, the vomiting center is located in the brain. It's not here. You want to vomit, it's not coming from here. It's coming from here. All right? So when you take a medicine, you should be able to get a medicine that binds to that receptor and it takes it into the brain, the vomiting center, and goes there to calm it down. And I don't feel like going to vomit anymore. Because the receptor is an agonist and it binds to that receptor site to be able to have the desired effect. So, antagonist, like you said, okay, so the receptor site, just like you said, is giving you this door. If this is a door, this is the receptor site, the key, right? Which is the medicine must fit into it. And that's why you have these two pictures here. So it's just telling you what a receptor site is and what is an agonist. Does that make sense? Do you get this? Do you get it or no? Come on, talk to me.
Yes.
Okay, let's move on to the next one. Antagonist medication means it's going to work against it. Agonist fits, works, it's good, it's going to have the effect. Antagonist is against it. Okay, so if you look at it, okay, it says here, antagonists are also called blockers or inhibitors. This means something will not happen in the cell. Some actions has been blocked or inhibited. Example of an antagonist medication is Narcan. Narcan will reverse the effect of what? Opioids in general. So it's Narcan an agonist or antagonist to opioids? Come on, talk to me. It's opioid. It's Narcan, agonist or antagonist to opioids. It's not. Antagonist.
It works against.
It's Narcan. Let me ask you this: is Narcan an agonist or antagonist to opioids? It's an antagonist. There you go. This is an against. Okay. When she's teaching, you could give her time to say what she's saying, and if it doesn't make sense, ask in a professional way. Give her a chance to land first, right? Then you ask questions. My teaching style is different, okay, and everybody's is different. So let's keep going. So antagonists, now we know, well, there are other than just Narcan that you know. I want you to look at antagonists. Basically, you can look at it this way as some way, somehow, some form of antidote, right? Antidote of a medicine. Okay. For instance, it's not 100%, but it will fit about 90%. You all know, and this I know you learned it from 100. I know you know about heparin. What does heparin do? What is your name? What does heparin do? It stops your blood from clotting. How? How does it do that? How does it do it?
It it does something to platelets. Yeah, platelet aggregation.
You're just using the words, but I don't understand. What do you mean?
It's like makes everything slick. Yeah, stops everything stick and makes stuff slick.
It makes stuff stick. Do you agree? Come on. Do you agree?
Mhm.
Do you agree? She says no. So what do you think?
I mean, it's supposed to, heparin is supposed to, be able to bleed, it's supposed to stop the clot.
Less sticky.
I mean, it's supposed to make it. Aspirin
You
stops
see,
it.
this is from 100.
Like
There's no
irrigation.
way you have left my class without knowing this. You will come back the next quarter because you won't pass. If you don't have this, there's no way you will leave my class. So let's talk clear, because I know sometimes we hold some of the responsibilities, but maybe I have to go back to the classroom and start teaching, because okay, you've got to know this stuff. It never changes. Let me help you out. Okay, heparin is a platelet inhibitor. What does inhibitor mean? It prevents them from coming together.
Making it sticky, less sticky.
Listen. Heparin prevent platelets from coming together so that you cannot clot. Because when platelets come together, guess what happens? You clot. You clot. When platelets come together, come. The three of you. Come on.
It's like the
Come.
part. So if we burn.
So look at us. All four of us are platelets. See right here. We are platelets. Let's all come together. Come on, man. Okay, we come together like this. We just formed a clot. So now, if you get platelets to us, if you get heparin to us, guess what? Hey, don't go yet, don't go yet. Let's try to come together, and we can't. Why? Because platelets heparin is preventing us from coming together. And if we can't come together, are we going to clot?
No.
We can't form the clot. So that's how platelets, thank you. That's how platelets work. It's a heparin
And the same
works.
like aspirin.
Well, yeah, kind of the same
That's what we
thing.
learned, aspirin is an anti-
This, exactly. So, and I wanted you to kind of think about the antagonist as an inhibitor, or think about it as an antidote. Because if we take one medicine to go this way and we take another to push us back, right? That's an antagonist. It prevents this medicine from doing one thing. That is an antagonist. I'm against you. That's what antagonist is. Against. Antagonist is just against. I'm against it. It's a blocker. Somebody is going to score the basketball, somebody blocks him. He's against him. Does that make sense? Antagonist medicines. That's exactly how it works. It inhibits, it blocks, it reverses. So somebody takes, why are you giving Narcan to somebody who took fentanyl? Reverse the effect. The overall goal is to help them to hopefully free the game, but we don't give it to you because I'm asking you the medicine. I'm not asking about what we're going to see on the patient. How is this medicine going to work? To reverse, to block, to prevent, to inhibit. Does that make sense? Yeah. So that's this slide. That's all you need to know about this slide. What antagonist, how it works. Any question on that? This one. Should we move on? Okay. Then we move on. We come here. The stomach contains hydrochloric acid. Everybody knows that. Hey, now you better know that. The acid we have in the stomach is called hydrochloric acid, HCl. Right? And what does it do? HCl helps to digest, helps us to digest food and a layer of mucus, different cells of the stomach, make these substances. Mucus protects the stomach from burning effects of the acid. Mucus is made by a chemical called prostaglandins. So on this one, we know, oh, well, there's hydrochloric acid in the stomach. Number one, we have different layers of the stomach that obviously does different things. Okay? Some layers produce mucus. What is the work of the mucus? The mucus is to prevent the acid from burning the stomach. Does that make sense? The mucus is supposed to, but so then what happens? If we don't have the mucus to protect the stomach, and then we produce hydrochloric acid, what will happen? It's going to burn. So if we got a medicine and we are taking it to reduce acid, you see, think about it. Which acid are we trying to reduce?
Stomach acid.
Which is the stomach acid? Hydrochloric acid. That's the acid we are trying to reduce. Because if we don't reduce it and we produce too much of it, what will happen to the stomach? It will burn, and what would the patient say?
Have a heart
I have a heartburn. I don't know. I don't feel like eating anything. That's what's happening. So if you're going to give medicine, they have to take an anti. Listen to the name. What? What does that mean? Against the acid. Don't make it hard. It's not hard. Remember I said this is not hard. It's not hard. Read it, break it down yourself, and let it make sense to you. Write it down like you're doing, and let it make sense to you. Okay? Let this speak to you. Every PowerPoint is talking. The question is, can you hear it? Okay? when you pick up a PowerPoint, ask yourself, what is it saying on this PowerPoint? Don't just reread it and just move on. You haven't learned anything. So, you think I need glasses? I think I need glasses. Okay, let's see. To understand how stomach acid is made, or is made, certain cells in the stomach manufactures the hydrochloric acid. Oh, I think we made mention of prostaglandin somewhere, right? Okay. Mucus is made by a chemical called, okay, so we know who makes or whatever chemical that makes mucus, right? If she asks this question, if she asks you any question on this PowerPoint and you turn around and you're like, but she never said it. Well, she said everything is sitting right on there. Do you understand what I'm saying? And I believe you, when I heard some students complain, which I welcome that, I looked at your text and I looked at the PowerPoint, and I promise you, I was able to match about 96%. And I'm like, oh, they didn't get it because I don't think they connected here. Oh, they didn't get it because, but I want you to be able to connect what's on the PowerPoint to the test. When she gives you this test, I don't want to see it. I didn't want to see the test for this PowerPoint. She said, well, this is my test. I said, I don't want to see it because I don't want to come in here and be influenced by what I saw. I just want you to get this. After this, I want to take the PowerPoint and I want to take the test she gave you. I want to see it because I want to make sure that what we are teaching you, what we are testing you. Remember, I asked you, what's going on? Like, we are teaching ourselves. No, I don't want you to feel that. But I want to make sure that we hold you accountable and responsible as well, right? Okay, so let's keep going. All right, let's see here. You talk about the receptors, right? We have histamines, okay? All right, these cells have receptors called histamines. Histamine 2 receptor or H2 receptor. When these receptors are stimulated by the chemical histamine, hydrochloric acid is made in the wall of the stomach. Oh, so let's go back. Let's try to make sense of this. Somebody read that whole thing. Just read it. Certain cells in the stomach, somebody read it.
Certain cells in the stomach manufacture the hydrochloric acid. These cells have receptors called histamine 2 receptors, H2 receptors. When these receptors are stimulated by the chemical histamine, hydrochloric acid is made in the wall of the stomach.
Okay. So how does hydrochloric acid made? How is it made?
From histamine.
Receptor.
Okay, so read it again. There's a connection there. I want you to connect it. Read it again.
Certain cells in the stomach manufacture the hydrochloric acid.
Stop. Some guy manufactured the hydrochloric acid. There's a guy. His name is a cell. We don't know what cell. Some guy is responsible for making these cells, this acid, right? We don't know the guy. Keep going.
These cells have receptors called histamine 2
Okay,
receptors.
so wait a second. This guy right here, this guy make, this is the cell, we don't know, but they make hydrochloric, but, oh, okay, wait. Well, yeah, Fascia can't remember. Okay, love you, bye. Okay. All right, bye. Okay. This guy, okay, he makes the hydrochloric acid, but we don't know his name. But on this, there is a receptor. That's all that statement said. What is the receptor's name?
Histamine.
That's H2. When H2 is stimulated, okay, keep going on that. Keep going.
When these receptors are stimulated by the chemical histamine, hydrochloric acid is made in the wall of the
There
cell.
you go. Does that make sense?
Yeah.
And I know you probably have read this like 5 times, but you are not doing the connection. You have to. So my question with the nurse is working with a patient who's currently diagnosed of gastroesophageal GERD. Which of the following is responsible for increasing hydrochloric acid production in the GI tract? Yeah. She never said this. That's exactly what you're doing. I promise you, I've seen the test.
You teaching, that's the difference.
Okay, so we get this, right? So is the stimulation of the H2 receptors that leads to production of hydrochloric acid. Okay, let's keep going.
Then a chemical reaction occurs by means of the proton pump. And then acid is pumped out into the stomach.
Okay, there is some kind of machine sitting somewhere. It's called proton pump. When all these things happen, acid is produced and proton pump pumps it into the stomach. And so now we have heartburn because this cell stimulated H2. H2 led to the production of hydrochloric acid, and that pump, proton pump the acid into the stomach. Now we have heartburn. This is a process you should be able to say it. Oh, this is a deal. Oh, if you're heartburn, oh, I know exactly what is going on. You see what I'm saying? Then you just say it. Okay, let's keep going. Go on to the next thing.
Prostaglandins help make the mucus lining that covers the stomach wall and
See, are we saying it again? Here comes again, prostaglandins again. Keep going.
Prostaglandins help make the mucus lining that covers the stomach wall and protects it from the burning effects of acid. Prostaglandins are also released from injured cells that send a pain message to the brain.
Okay. So prostaglandins is doing a very good job here. It's helping us to protect the GI tract by producing what? Mucus. But it said prostaglandins are also released from injured cells that send pain messages to the brain. So prostaglandin is now going to serve basically as a link to the brain, tell you, hey, you are in pain. Do you see what I'm saying? So prostaglandins is playing two major roles here. One, as a messenger to the brain to help us know that there is pain, and two, is producing what? Mucus to protect the GI tract. Okay. So some people have problems where their acid brings about pain or stomach ulcers, or lack of mucus in the stomach brings about an ulcer. Gastroesophageal reflux disease or GERD, acid reflux, peptic ulcer disease, stomach or duodenal ulcer. So now we understand what GERD is. We understand where the chemicals and whoever is involved in causing GERD. Then she comes here and talk about GERD. On my farm class or farm exam, if I were to test you this, I'll test you everything that we're talking about. I'll test you the medicines. If you don't understand this, how do you understand how the medicines work? This is the pathophysiology behind GERD. And if you get it, you get it. So let's keep going. Acid reflux from the stomach into the esophageal from a weakened lower esophageal sphincter that does not close like it should. So in the stomach, obviously there's a muscle right at the end from the esophagus to the entrance of the stomach. There's a sphincter there. Sphincter is a muscle, like it's supposed to close like this. All right, when we are not eating, it's supposed to close. Some people have a weak one. So even when you're not eating and it's supposed to close, instead of close like this is how it is. It's supposed to be like this. So it's like that. And it makes it easy for gastric content to kind of back up on you. And then remember, it's acid in the stomach, which is supposed to go down. Now it's coming back up. And that's why you feel it. Does that make sense? Or if it's a little bit deep down, the duodenum right at the end, there also has a sphincter. But if it doesn't close and open well, the same thing. And that's where we have those duodenal ulcers. If it is not in the stomach and it's deep down, it's called peptic ulcer. Does that make sense? So we have obviously heartburn or GERD as a result of a weakened esophageal sphincter, or we have peptic ulcer, which is a little bit deep down into the duodenum, which is the first part of your what? Duodenum is part of what? Small intestine. It's part of the small intestine. So if you start developing ulcers in there, then we know that sphincter obviously is a little weak, and then acidity is getting there, it's causing this problem. Clinical judgment. You can read this. The acid in this region causes burning sensation. That one's something you can read yourself. You don't need to know. Clinical judgment. Due to this proximity and all, you can read all that stuff. Some people complain of heartburn as if they're having a heart attack, because the pain is so close right here to the heart, and they think, oh, I'm dying. No, it's heartburn. People come into the ER a lot, complain of that. We do all the cardiac stuff, and there's nothing wrong. And we know it's a peptic ulcer. Okay, hole in the wall of stomach or the duodenum. Okay, caused when the mucus lining. We all know that we need the mucus to help us protect the GI tract, right? Specifically the stomach. If we don't have enough of that prostaglandin working to produce the mucus, obviously the acid will burn it out. It will erode the GI tract. It will erode the stomach. It will bore a hole into it. It's an acid. It will just keep eating it, and before you know it creates a crater. And now you have, sometimes food may get trapped in it and cause all those kind of problems. Sometimes too, you may have, see, the lining, just like you have, your skin is intact, it's not open. When it opens, bacteria enters, it's infected. The same thing goes there. The stomach is supposed to be, obviously well protected and no opening. When we don't have that, and then acid burns it, and now you have a wound there, bacteria called H. pylori enters, and then you're in trouble. So peptic ulcer, obviously, or PUD, peptic ulcer disease, occurs when you have the intestinal lining obviously eroded, and you have Helicobacter pylori or H. pylori causing, problems for us. How do we treat it? I think it will come back to that. But yeah, other than the ulcer, the acid itself causing the linings to definitely, erode and cause problems. Sometimes medicines that we take can actually increase the process of destroying the GI tract, right? Medicines like what? Aspirin, NSAIDs, aspirin and NSAIDs, non-steroidal anti-inflammatory drugs, right? And that's what is listed: Advil, Aleve, ibuprofen, naproxen, Mobic, Celebrex. All these are NSAIDs. And if you take too much of it, obviously you increase the risk of burning or destroying the stomach lining, which can lead to peptic ulcer disease or just straight GERD. Does that make sense? You guys get this? Are you getting it?
Yes.
Okay.
You explained it a lot better.
But everyone is different, I've put a lot of my instructors in trouble. So I do this, and then the instructor goes back to the classroom. They're like, well, she's not explaining it like Miss Livingston explained it, or the other person explained it. Yes, of course. So every instructor is different. I always encourage you, give the instructors a chance, because they all mean great. They mean well. I go through a lot to hire somebody, and before I really put them in the classroom, I'll make sure that they go through the appropriate training. Miss Linda is a very good, lady. She's really knowledgeable. She's done so much, and this class is not one that is beyond her. So, okay, examples of NSAIDs, right? We have them here. I think we made mention of all of them. The Naproxen, Celebrex, ibuprofen, and these you can read. You can read this yourself. You don't need me to do that. All right, peptic ulcer disease, and it goes on and on and on and on and on. And then we have hematemesis. So you have peptic ulcer disease, you can bleed, right? Okay, emesis means, what is emesis? Emesis, throw up, vomiting. And hemat means what? Blood. So hematemesis. What are you doing? You are vomiting blood. Right? Okay, so that's why you see this person. And if you're vomiting blood, actually, normally from like a GI to like in the stomach, it's bright red blood. You see it. You can, when you're vomiting blood, sometimes you may have coffee ground emesis as well, which also indicates, bleeding, but that's an old.
That's old blood.
Oh, blood, yes, yeah.
Would that be like at the bottom also?
When you have a bowel movement, is that what you mean?
Yeah, no, like, wouldn't it be coming from the bottom, or if it's old, and then if it's lighter, it's coming from the top?
It could be. It all depends on timing. Because if you bleed and you eat food and it mixes up with it and blah blah blah, it stays there for a long time. Certainly, yeah, it'll be brown. But if it is actively bleeding right now and you're vomiting it, we expect to see bright red blood. Yeah. Okay. So and so here, we're talking about bleeding. So there are occasions whereby you can see bleeding not only through vomiting, but also through the stool, right? And that's why you have what? Melena. Melena is what? Dark tarry stools, right? Or dark black stools, or black stools, you see it. It means that the person has a GI blood or GI bleeding. And so it has here a black hair. Yeah, bleeding, yeah. When you see melena, most of the time, melena obviously indicates that they have an upper GI bleed. All right, because if you think about it, upper GI bleed, we're talking about somewhere in the stomach and then in the duodenum portion of the GI tract, right? Because then it takes a long time before, it comes here, before we have a bowel movement. If we have stomach here, connected to the esophagus, okay, so then we know, okay, the esophagus connected to the stomach right here. If you bleed somewhere here and it goes down, look at the route at which it has to go. Okay, this is the duodenum, right? Okay, from the duodenum, where do we go in the GI tract? From the duodenum, where do we go?
Large intestine. Oh,
The duodenum, the jejunum,
the large
the
intestine.
jejunum.
I know, I just saw it.
Yes,
Okay, so from the duodenum, where do you go?
And then to the small intestine.
I want the names.
the duodenum, the jejunum.
DJ Ilian.
DJI,
DJI.
DJI, duodenum, jejunum, ileum, and then where do you go? What's your name? Angel, where do you go from that? Okay, mention them. You guys, I don't know how you're passing your classes.
Ascending, it's the ascending,
Mhm,
ascending,
mhm.
Ascending, transfers.
transfers,
Hmm?
transfers,
Ascending, transferring.
Thank
and
you.
descending.
Good. All right, you can't forget like that. You really can't. This is the foundation of your nursing career. If you tell me you don't know parts of your intestines, that's a problem. I don't know how no, you can't. You must have these things literally on the fingers. Oh yeah, DJI, like you said, DJ Ilya. It just works. It works for you, but you cannot forget it. But anyway, all right. Okay, so let's go to foods. It's talking about some foods. Foods you should avoid when you have heartburn or acid reflux. Okay, chocolate, coffee, tomatoes, carbonated beverages, peppermint, okay, high-fat meats, garlic, cheese, citrus fruit, So if I want to test you this, I'm not going to ask you this question. This is how I'll ask you. The nurse is working with a patient who is currently diagnosed of gastroesophageal reflux disease. Which of the following will be a priority? Nursing education, or which of the, do you see what I'm saying? See how I'm asking the
Yeah.
question?
You would inform them of the foods that they should avoid.
Okay, so I haven't given you the options. The option is, okay, stop eating tomatoes. Drink a lot of food when you, drink a lot of drink a lot of water, when you're eating. Okay, at least wait for 4 hours after eating before you lie down, and ambulate for 20 minutes after you finish eating. What would be your option?
Stop tomatoes. Don't eat tomatoes.
And then
I would think stay up for 4 hours.
Well, that's
But
that's
if you eat the tomatoes, it's gonna flare
that's
up.
no, that's the answer. We don't tell them stop tomatoes. You can't.
You
You
recommend
don't-
that they might want to avoid eating tomatoes.
Okay, or reduce the intake of it. Be mindful. Yeah, stay up. That's actually, see, that's what kind of makes it a little hard, right? That's what makes nursing is like, well, that's correct. But then the other one is more correct. So we don't tell patients, we're not going to tell them, stop eating tomatoes. No. Just so you know, foods such as this, that, and that. Oh, no, please go ahead. Obviously, will flare your stuff up. If you're going to eat it, it's like this, tiny bit. All right? But if you want to avoid it, probably will reduce, the signs and symptoms that you're experiencing. But when you finish eating, stay up. That one we're going to be emphatic. Stay up. Right? Or the questions, she can also bring the questions and say, which of the following, foods or whatsoever should be avoided. She won't tell you citrus foods or and they say select all that apply. And you can say, okay, well, and chocolate will be number one. People, why do I have to avoid chocolate? Well, sitting right there on your PowerPoint, chocolate, cheese, or just, Dr. Pepper. So what has Dr. Pepper got to do with this? Everything, because we're saying carbonated beverages. So she will say them like, she will mention them instead of actually saying citrus. You have to go?
Yes, I gotta take my son to the hospital.
Okay. How old is he?
He is 10, he's in an asthma flare.
Oh, go. Yeah, so go back to the PowerPoint and reread it, tear it up. If you pick up a PowerPoint and then we take it away and you can't answer questions on it, you don't know. And there's nothing you can say to anybody to convince them. You just don't know.
Sorry.
Yeah, you're okay. So make sure you own your material. You understand what I'm saying? Own it by breaking it and making sure that it makes sense to you. And I hope the way I'm going through it with you, hopefully you can learn something and know how to approach it. Okay, so that's all is there. Okay, small frequent meals is better. This is a very simple nursing question. We ask that a lot. Patient may ask you, the patient may, you may educate the patient instead of having 3 huge square meals a day, you can break it into about 5 to 6 meals, tiny little bit. Okay, so as you say here, small frequent meals are better than large meals. Okay, less acid production, do not eat before bedtime, do not lie down after eating. If severe sleep, prop up on pillows or elevate the head of the bed. So these are things you definitely need to know about exactly what we're talking about. Okay, so I want you to know that we talked about the proton pump and the histamine too, right? let's go to the next page. Page 8, and we're gonna look at medications of GERD and peptic ulcer or acid problems. Okay, if the acid reflux is caused by H. pylori, what should we do with it? Give antibiotic to kill it, right? If we kill the H. pylori, acid reflux certainly should go down. If it is caused by it. If the problem is as a result we are producing too much of acid, what should we do? We're going to give medicines to reduce the production of acid. We gotta give, okay. If the problem is because you have an acid because the lining of the GI tract is eroded, let's give medicines hopefully to cover it up.
You give antibiotic and.
Well, it depends. I want you to know the different ways to treat it. If it's caused by H. pylori, let's treat the H. pylori. If you're producing too much of acid, let's give medicine to reduce the production of acid. If your problem is because there is erosion, like the GI tract, the lining is eroded, right? Let's give medicines to cover it up. All right, and I'm saying these things because that's how we treat acid or heartburn. So we're going to have, it says, if caused by bacteria H. pylori, give antibiotics, kill the H. pylori. Combine 2 to 3 antibiotics for 14 days. Take until all gone. What do you remember about amoxicillin and tetracycline?
Take it with kids, my pregnant people,
You must always finish your
the stain your teeth.
tetracycline can. Yeah. Amoxicillin is a good medicine. You can use tetracycline, metronidazole. I want to say this: if you're treating H. pylori, it's not one medicine. It's a combination of medicine. As a matter of fact, there's another medicine that some, should have preferred included here, which is a PPI. But H. pylori is a combination treatment, and it's going to take at least 14 days. Does that make sense? It's a combination medicine. You can't just treat H. pylori with one drug. Good luck. It's not going to work. So medications. Remember we said we know what histamine does. Activation of histamine leads to what? Production of what?
Stomach acid.
Activation of histamine leads to the production of stomach acid. What is the name of the stomach acid?
Hydrochloric acid.
Okay, so if we know H2 or histamine 2, when it's activated and it causes production of acid, what should we do if the patient has, what medicine should we give? If the patient has a problem with GERD or peptic ulcer, what medicine should we give? We should give medicines that will stop or reduce the production of acid. This case, okay, what was your name again? Angel, come in. All right, so this is histamine Angel. Angel histamine. When Angel goes, she gets upset, right? And I don't like what's going on. Guess what happened? There's a lot of what is produced. Acid is produced. So let's give some medicine to shut it up. If we shut Angel up, well, guess what? We ain't going to produce no acid. That's what H2 receptors or antagonists do. Histamine 2 antagonists. Listen to the name. Against Angel. Medicine that we are going to give against Angel so that Angel won't be, come to class and causing all this trouble. Are you? No. Okay, good. Go ahead. So if we give medicine to calm Angel down, we are not going to be producing the acid. And that is what the class called H2 histamine 2 antagonist. That's what they do. Okay? Or histamine 2 blockers. As you can see here, histamine blockers, H2 blockers. How do they work? They work by preventing the production of acid by blocking histamine, blocking the histamine to activate. And almost all H2, okay, it's so easy to find them. What are they called?
Antacid,
Say it again?
antacid.
No, but they give me, what are the generic name of H2 receptor blockers? The tidines. The tidine drugs. Tidine drug. All of them. Cimetidine, formatidine, loratadine, ranitidine, tidines. Once you say, oh, tidine, you don't need to know angiotidine. You know it's what? What do you know to angiotidine to be? What class of drug is angiotidine? Thank you. You have to learn the class. Don't memorize the medicines. H2. Yeah, it's H2 blocker. Learn the class. H2 blockers. When we say H2 blockers, what do they do? Yes, what did H2 blockers do?
Block the histamine.
Why are we blocking histamine?
Because the stomach is dominant.
Why are we blocking histamine?
Blocking histamine, so we don't have the symptoms that come.
Why are we
The
blocking
acid,
histamine?
shut the acid up.
Shut the acid up. But why are we blocking histamine?
Electric shock or something.
It stops it from making.
Oh my goodness. Listen, what I've been saying that when H2 is activated, what happens? We produce acid. We produce acid when H2 is activated.
We have too much acid to the H2 receptor.
So what do we do? If you don't want too much acid to be produced, what should we do? Block who?
H2.
That's it.
So would histamine blockers also be histamine antagonists?
Absolutely they are.
Okay.
They are.
They all, okay.
Inhibitor, blocker, antagonist, whatever is, that's it. You've got to do this connection. See why I'm telling you, you can't just pick up this material and try to study it one day and you think you're going to pass this test. Doesn't matter how smart you are, you won't pass. You've got to get it. Found, you must understand it. You can't memorize anything through nursing school. There's some few things you have to memorize, but you have to understand the class. So the point I was trying to make here is, if you know all your tidines and you know how the class of those medicines works, you're done. You don't have to know all the medicines and know the tree, not the fruits. The fruits is nothing. Know the tree. The tree is the class. H2 receptor blocker, how does it work? It works by blocking or inhibiting the production of acid. Why? Because if we don't inhibit H2, more acid will be produced. If more acid is produced, the patient will have a heartburn. So how do we prevent the patient from having heartburn? Block the H2. That's Angel. She's all the class. Block her so that she cannot cause acid production.
Makes more sense.
Does that make sense?
Yeah.
Okay. All right, then you can read all the other stuff associated.
We need to break down in the classroom.
Yeah.
Wait. Sit. Okay.
We need you.
All right. So there's another class of drugs which is called PPI. Listen to the name. Proton pump inhibitor. What do we say proton pumps do? Okay. Well, listen to my question. What did we say proton pumps do?
Pumps the acid in the stomach.
Perfect. So listen to it. It pumps. Okay, question, true or false? Proton pump produce acid, true or false?
False.
It's false.
No, it just pumps it out.
It only pumps. It didn't make no acid. Somebody made the acid, but somebody need to pump it into the GI tract, and that is the proton pump. So, well, the person made the acid. We know it's made already. Well, let's try to reduce the acid coming into the GI tract by doing what? Blocking who? The proton pump. We're going to block the pump so that it cannot produce, it cannot push it into the GI tract.
So the same thing as the H2.
The same thing is an inhibitor. You need to understand how the acid is getting there. Somebody's gonna get angry, and so that then the acid is produced. Then somebody else has to pump it into the GI tract. So we are going to stop the acid from its tracks from actually getting into the GI tract. That's why we're going to, yeah. That's why we're going to give what? A proton pump inhibitor. We're going to inhibit the proton pump so that it cannot pump. We're going to shut the pump down. Then you have PPIs. All PPIs end with this: prazole, 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 prazole. Know the tree and then add the fruits. Proton pump inhibitors. These are pantoprazole, esomeprazole, lansoprazole. What's your name? Sheriprazole. That's a PPI. In nursing school, we won't teach you everything. We cannot teach you all the medicine. But as soon as you see sheriprazole, what does that mean? What medicine is this? It's a PPI. Does that make sense?
Mm-hmm.
Okay. If you say so.
Makes more sense than what I had.
Yeah.
Okay.
Explain it now.
Yeah.
All right. So, okay, we move on to page 10. Remember when I was talking, and I knew exactly what I was talking about. I said, if the problem is caused by the erosion, let's get something to do what? Cover it up. Look at what we are reading now. Mucosa what? Barrier. The mucus. We're going to cover it up. How do we cover it up? With a medicine, which is a mucosal barrier called sucralfate, caraphate. The nurse is working with a patient and currently administering several medicines to treat GERD. Which of the following medication is a mucosal barrier? I'll give you Maalox. I'll give you pantoprazole. I'll give you caraphate, and I'll give you famotidine. It's caraphate. Because that's the only mucosal barrier with the medicine. Every medicine I give you, we used to treat acid, but they are not mucosal barriers, except caraphate, sucralfate. So you see why you're saying the teacher is like, she's testing you with information that you've never received, but it's sitting right in front of you. It's there. Mucosal barrier. Mucus, you're going to.
Caraphate stops mucus from.
I didn't say that.
Not stop it, but it helps.
I didn't say that either. It covers it up. It covers what up?
The lining.
The lining. Why are we covering it up? Because you have a hole there. The mucus is eroded. You have erosion. You have scraping. Like you fell, and then you have, what is it?
Like a Band-Aid.
That's it. Think about it that way. It's like a Band-Aid. Let's put it on it. So then let's cover it up so that we don't have the heartburn. It's a mucosal, the GI tract cover. We're going to cover it. That's all it's doing. So we've talked about H2 receptor blockers, PPIs, mucosal barrier, and we've explained what is really causing all these burning sensations that we're talking about. acid and peptic ulcer and H. pylori and all that kind of stuff. And we know what we're going to do. If somebody has heartburn, we're going to say, avoid or try your best. Don't be drinking too much of this when you eat. You know, don't just stay up at least for 4 hours. You know, eat small, frequent meals rather than large. This is all we're asking you to know. Are you listening? This is if we are not asking you to know more than what you're supposed to. I want you to now really read your PowerPoint different. Study every PowerPoint has a message on it. They all have information on there. Don't memorize the medicines. Know the class. Know the class of the medicine you're talking about. Know everything about the class. Then put the medicines on there. Every class has its own specific ways of knowing them. Okay, question. Who have another question? What's your name?
Tikira.
Tikira. Famotidine. What class of drug is this?
H2.
H2 receptor blocker. Is she right?
that right?
I don't know. Is it right?
Let me check. Hold on. What's the name? Right.
Famotidine.
Famotidine.
Mhm.
Yeah.
Girl.
It's a dean.
Don't doubt yourself. You got it.
I got it.
Hmm? It's a histamine antagonist.
Yeah.
It's a histamine blocker. Okay? What's your name again? Alicia. All right, Alicia. Which of the following medicine is a proton pump inhibitor? Okay, no, let me say, and then you tell me what class of drug is it? Acetylcysteine.
This thing is a histamine blocker.
Okay, you see, I just confused her.
Yeah.
It's not. It's nothing you have heard.
Yes.
And I know. I hear you.
Team.
I hear you. I know exactly what I did. Acetylcysteine is actually the antidote to Tylenol. It's the same as Mucomist. Acetylcysteine, Mucomist. Let me be fair with Alicia. Now your real question. Now let me be fair with you. Okay. What class of drug is lansoprazole?
That is the acid. Say it again.
What class of drug does lansoprazole belong to?
Is that the pump one?
It sure is the pump one. That's proton pump inhibitor. It's a PPI. All, and I mean all PPI has this at the end. All of them. Prezzo, all of them. All the H2 blockers has this at the end. Tidine. You see how this information is not that simple. You understand what I'm saying? And then nausea and vomiting. You almost done, don't worry. You spent 1 hour. I wanted to make sure. I want you to approach. Do you feel like now you can approach your PowerPoints a little different?
Yes.
You have to. You have to. I
I
will
feel like
not.
a little explanation in the class would help too.
I
Versus
understand.
just literally reading the PowerPoint, something we can do. on our
You
own,
don't
'cause we
understand.
know what we
I
read.
understand. And
Basically broke it down for us.
Yeah,
I would rather stay a little longer if it's being broke down.
but we leave early, literally
than
every class.
Just
'cause
read
it's
the
not being broke
PowerPoint,
down.
showing a couple pictures and go on about your day.
no, we can't do that. This Wednesday, I'll come into your class a little bit later on. I'll come to the class.
Don't
So
come too late, we might be gone.
I'll come into the class. You guys start at 1, you're supposed to end at what time? Okay, so you stay till then. Have to. So, we'll see. But yeah, Wednesday, I'll come in a little bit later. I have some meetings scheduled and stuff. But anyway, so nausea and vomiting, we all know what nausea and vomiting is, right? But like I said, the vomiting center is located not in the stomach, but in the brain. Okay? Oh, it's even in there. Boom. Okay. That's where when it's activated, that's the reason why when people, when they bump their head, the guy bumped his head and he's vomiting. What has that got to do with him vomiting? People who have no medical background think the problem is here. But he bumped his head, and that's why he's vomiting. You, the nurse, you understand it. Because the vomiting center is not in the tummy, it's in the brain, specifically in the medulla oblongata. Does that make sense?
Yes.
Okay, so what does it say here? Certain things trigger the vomiting center in the medulla. The pain, sight, smell, taste, emotions, opioid medications, chemotherapy for cancer treatment, hormonal changes during pregnancy, post-op nausea and vomiting, general anesthesia, toxins, inner ear infections. See, so if somebody's going to feel nauseated and vomiting, you haven't heard us say even infections yet. Do you understand what I'm saying? So, but here we are. So many things make people vomit. Okay? And she say head injury, she did it. But this head injury is a big one, and you're going to learn it, when you go into med surg. Med surg 3. Med surg 3. This is it's the last class you take. You're going to add to all the information you have. So, where is the vomiting center? Okay, so nausea and vomiting. Okay? Always pay attention to how much the person is, how much they're vomiting, how much fluid they are losing, how many times that they are vomiting. Really critical. Okay? This is something you guys can read. I want to touch on the medicine. Let's see. Antiemetics. Okay, here, page 15. Listen to the name. Emesis is what? So listen to the class of drug. What is it called? What does that mean? Against throwing up. Anti-Alicia means against Alicia. What's your name again?
Brandon.
Anti-Brandon means against Brandon. Brandon blocker means we are blocking Brandon. Brandon inhibitor means we are inhibiting Brandon from working, or whatever he wants to do, we are going to stop him. Brandon antagonist means we're going to work very hard against Brandon. These words, you got to be familiar and it should be easy with you. Okay? So anti-emesis or antiemetic means against emesis or vomiting.
I have a question. So when we studying the medications, should we know the generic name or should we know the
Both.
Because when we get to testing, it's
Yeah, and you should actually be taught when she gives you the medicine issue, and she is doing that. On NCLEX, they will not give you brand names. They give you the generic names or generic and brand names. So you should learn both. They won't give you just brand names. No, that's wrong. They cannot do that. They will not do that. But the generic name like promethazine, and you know that as well. Phenergan, you may not see Phenergan there. Or you're going to see ondansetron instead of Zofran. You might not see Zofran, but you see ondansetron. So you must, it's a must. But they told you this in Form 100. You've got to know the generic names. There's a test generic and brand names and the Inform 100.
Some definitely have to test it on well, they're just about the.
I learned the generic names. I'm required to know both the generic and the brand names, but now I'm confused. What is the generic name for this? Ask that. Ask you. That's your education. You know what I'm saying? Ask it in a nice way. Don't be, hey, well, she give me a wrong test. I don't even know she ain't getting it. Oh, okay, slow down. Let's just talk. And I understand, trust me, when I was a student, I felt the same way. I probably did the same thing. So, but anyway, antiemetics, right? Ondansetron, promethazine, antagonist at vomiting center in the medulla oblongata. Do we really have to read this? Like, we know the medulla oblongata is where the vomiting center is. When it's activated, we vomit. So we're going to take medicine to prevent it from getting activated. Done. You know what I'm saying? It's done. It's that simple. And then we learn these are medications that block the neurotransmitters at the vomiting center. Once you get that understanding, everything just follows. Okay? The neurotransmitters in the medulla oblongata in the brain, they are antagonists. We've been saying it over. I've been saying that over and over. Chemical structures of the ondansetron. Who cares? Chemical. This is not chemistry school. Nobody cares about chemical structure. Okay? Because do you know the medicine? Do you know how it works? Do you know what class it belongs to? And if you give this medicine, do you know what to do? What to look for? If we're able to do that, you're done. Some antihistamines works by reducing vomiting. An example of those antihistamines include imiphenolate or Dramamine. Dramamine is an antihistamine. Okay, even what is it? Zyrtec, cetirizine. It's an antihistamine. Promethazine, Finnegan is an antihistamine. All right, but it helps prevent vomiting.
Thank you.
Particularly good for motion sickness, Dramamine. Okay, take about half to 1 hour before activities that produce motion sickness. Like if you're going on a cruise, or you're going to fly or something, and you feel like you're the one when the plane does this. Okay, then take it before you go there. Meclizine. Okay, listen to this. Most, I didn't say all, most, H2, some histamine, well, let me not confuse you. Okay, know that. Just know cetirizine, promethazine, what is it, meclizine. Meclizine is a very known medicine for motion sickness. Because when people have motion sickness, they vomit, right? And we want to reduce that vomiting. And that's what we're trying to do. Okay. I want you to definitely tackle this a little different. Okay, tackle your PowerPoint different. This information is certainly not beyond you. This information is certainly not beyond you. Do the reading. And reading is different from studying. A lot of you are doing reading and you're not studying. You can read this 50 times and get 20% on the test because you didn't study. You read, I get you, you colored it all through. That's not studying. Let's pick a PowerPoint and let's study it together. And then that will be it. There we go. You pick another PowerPoint. Let's study it together.
Constipation.
Which one?
Constipation.
Constipation?
What's the next
No, pick a class of medicine. Constipation.
one? Okay.
Pick a class of medicine.
So far.
Stew softeners, what page is it?
23.
22. We've, this PowerPoint, we've covered the difficult part that causes confusion. I thought it would do those areas that we've looked at it. 23. We've covered, the difficult part that requires like thorough understanding. Okay, so let's look at stew softeners. You've heard of stew softeners, right? So let's study this PowerPoint.
What page?
23, the bullet point at the bottom. Stew softeners. Pour water into the stew to make it soft and easy to pass. College. Add bulk to the stew, mix stew bigger, which naturally draws water to it. To soften it, making it easier to pass, identical to high fiber, need to consume full glass of water. It's because it becomes a gel-like substance in the GI tract. You're right. Cilium. Okay, good. We're done. Are we good? We just read it.
I think
That's what we do.
That's the problem. I know.
It's another class.
And you know, so she may, I don't read. I haven't seen this material for over 8 years. I've not seen this, but I know it, so I can teach it. But this is the point. When you go home and you are studying, what I just did was just read. I haven't studied even one sentence or one word of that PowerPoint. Zero. So if I do this and I come here to take a test, I will fail it. Now let's see how we study this. So, stew softeners. Stew softeners. Pour water into the stew to make it softer and easier to pass over. So stew softeners, what do they do? So stew softeners pour water, and when it pulls water to it, it makes it easy for somebody who take the stew softener to pass. So what stew softener is doing is that it pulls water to it.
Isn't it making, like it pulls it into the feces to make it. Okay, so it's like, say, if you're constipated, it's probably more of the dried up substance, so it's gonna put water in it to make it like more lubricated to come out.
Easy. It doesn't have to be lubricated. The stew has to be in some consistency so that's easy to pass. And that's what stew, listen to the name. It's softening the stew. It didn't lubricate it. It only softened it. How did it do it?
From the water.
Where is the water from? That's it. It pulled water to the GI tract, softened the stew, so that makes it easy to. Oh, now you know how stew softeners work. How do they work? And it makes it. Now you have studied. You just studied about stew softeners. You know how that class of medicine works. Stews, you stop, you read and stop. And make sense of what you read. What did it say to you? If you read, you speak English. Me no English. Me the African. I don't speak English. You, that's your language. You're like, and you're done. You got nothing out of it. Read, stop, and make sense of what you read. That's what studying is about. Sometimes 4 sentences, all you need is just 3 words in that 4 sentences. That helps you to study everything. Listen to it. Listen. Pulls water into the stew to make it softer and easier to pass. All I need to know is stew softeners, pulls water, makes it soft, and make it soft. Now you can put. Yes.
Right here.
Now let's go to the other side. Let's go this side. Or is that where you were going?
Now we're going up at the top.
Okay, give me a second. Then it says bulk forming laxative. Somebody teach us how to study this.
It
Help
makes
us.
it thicker. Whatever that Metamucil makes it so your.
Go back. You just learned the medicine, that's a bulk forming. Go back to the class. So say it again, figure it out, tell us how we should study or teach us how to study it.
So you add to your story.
To make the form to come out.
Okay, so all you're supposed to know, listen to the name. Bulk forming. It just add bulks. It makes it bigger. You see, don't hang on to bulk forming. You will forget. It's not word that we know that, right? But we know bulk forming make it bigger. It adds to it and give it volume, so that it's easy to come out. That's all you need to know about bulk forming. Then you go back. So which of this is a bulk forming laxative? Then you add Metamucil. Which of those that was a stew softener? What did it say? Doki say. That's it.
No, we can't
So you
say
s-
color, so we have to say
Doki say. But so you see how you don't read and come. You're very welcome. Don't just read because you're doing reading. You're not studying.
It's back there.
Now let's go back up and then we'll be done. Yeah, go ahead, please.
About when it said, do not administer laxatives to a client with fecal infection.
Mm-hmm.
If you have fecal infection, they want it out, or is that why you have to?
Well,
Make
it will really help. And that's what is really going to happen is just it's going to pull fluid and you're going to have diarrhea rather. Okay. If it is impacted, several ways that we use to definitely fix that problem.
Pull it out,
Take it out, visual stimulation and stuff to really bring it up. And it can cause problems. It can cause infection of the GI tract. So when somebody we know is a confirmed infection, it's contraindicated to give them suicide.
what do you give them?
Well, we need to fix the
You have
problem.
to do the. Right.
We got to do digital stimulation, hopefully. Sometimes enema might, you know what I'm saying?
Sometimes it'll go around it, so you'll just have that water.
It will, yeah. Because we need to find it. Any questions before we leave? That just help.
Yes.
Guys, you gotta tackle your studying a little different. You've got to. Okay? This is information that it's a must. You must know. If you know it, it will never get away from you. And it's doable. Don't feel defeated. This is week 6, right? Okay. Don't feel defeated. Push yourself. Don't because this requires you to really think. But before you can think through, you must know the information first. Okay. What is she?
What about this one?
Yeah, you can-
I have one.
We need this, pink glass. Pink glass.
I'm looking at it from different eyes.
Can you come back and help us with these?
Right?